My name is Osunsanya Tomisin Osunsanya. I'm a medical officer here at South Shore Women and Children's Hospital. Okay, I have chosen this field of specialization because of the target group. It's targeted towards women and children. And for me, pediatrics has always been a challenge. You're dealing with patients that cannot necessarily speak for themselves. So you have to be very intuitive in making your decision as regards their management. And that's very challenging, but it's very interesting to me. It challenges me as a doctor. For obstetrics and gynecology, it's being on your toes. You have to be able to make decisions very quickly. Something can be going very smoothly right now, labor can be going smoothly, and all of a sudden things change, the dynamics change. And for that, I would count myself somehow as an adrenaline junkie. And because of that, I find myself very useful and very satisfied being in this area of specialization. So I have been working as a doctor for 5 years now. I've been working in South Shore for 8 months now, if I remember correctly. Yes, 8 months. Working as a doctor, it's been a roller coaster for me, to be honest. However, it's been a gratifying experience, knowing that you can change someone's life by the management you put in place. It's very gratifying, knowing that you can bring life into the world, knowing that you can change the situation of a family, the dynamics of a family, just by your input and just by your professionalism is very gratifying for me. So I have worked in different institutions. However, what has been most interesting about working at South Shore is the things that I've been able to gain over the past 8 months. Here we're focused on, we're patient-centered. So we're focused on ensuring that our patients have the best of experiences. So it's not just about giving them good medical care, but ensuring that once they come in, they have the best of experiences they can have. I have been able to sharpen my etiquette when it comes to dealing with patients. You deal with patients in a way whereby they feel that they're satisfied having met you. They are satisfied in the kind of medical care they have received. They are satisfied in the way of delivery of the medical care. They are satisfied in understanding their medical conditions. Medical conditions are explained to them to the best of our abilities. So for that has been like an added plus to my own experience as a doctor. So for being a doctor, the skills that I think I have perfected over the years is great interpersonal skills. As a doctor, you have to be able to relate with people on various levels. So you have to be able to communicate effectively. You have to be able to pass your message across to your patients and even the people that work around you. You have to be able to work with people because it's a multidisciplinary approach. You have to work with other people in your other professionals. You have to work with other people in your team. So you have to be able to understand people and work with them effectively. Outside of being a doctor, I think it would shock a lot of people that I'm also interested in dramas, acting plays. While I was in medical school, I was part of the drama group for my fellowship, for my school. I did a lot of work in terms of acting and singing as well. So I think that will shock a lot of people. Most people think that doctors, are very, very rigid, very straight to the point, but I also enjoy the arts as well. Okay, so I'm going to show you now how to correctly wear a face mask. It's important for us to know that we're in perilous times with COVID-19 infection going on, spreading like wildfire, and it's important that we know how to wear our masks, so I will do so. Usually, you will need to wash your hands with soap and water. However, if you do not have soap and water to wash your hands, you can use a hand sanitizer. I do not have soap and water with me here, so I will use a hand sanitizer. I have a hand sanitizer with me. I'll apply it to my hands and ensure that I adequately have the hand sanitizer on all surfaces of my hands. Okay. So once my hands are appropriately sanitized, I will pick up my mask. It's important to know that you pick up your mask with the straps, and that there are two surfaces of the mask, I meant to say. There's the outer surface and there is the inner surface. So I will ensure that my hands do not touch the inner surface, which is going to be on my face. So I would use the strap or put the strap around my ears, making sure not to touch the inner surface. So I will apply like so. If I require adjustment, I will just tug on gently. And then there is a surface at the top here. I'll need to pinch down just to ensure that there is no gap between my face and the external surface of the mask. Thank you so much for paying attention. Have a good day, everyone. Thumbs up.